Coronavirus has entered Africa, with Egypt confirming its first case of COVID-19. South Africa still remains coronavirus-free. To discuss the measures in place to ensure that the country stays that way, we're joined by Health Minister Zweli Mkhize. Very good morning to you. Can you update us on the status, please? Obviously concerned that it's entered Africa. Are we prepared?
Well, for an epidemic or an outbreak such as the coronavirus has shown in China, no country can ever say they are well prepared for it. I think we can do our best. There are certain basics that we have had to take into account. And so as South Africa, we are ready to respond whenever there is need to respond. And so what we can say is that at the moment, we have places ready to be able to admit patients if they were to be discovered in South Africa, and that we have got staff trained to be able to ensure that there is a limitation of the spread of infection, both to the staff and to the other patients. And so on that side, we are ready.
Okay, because I know there's concern, considering the ill state of our hospitals, that if it were to erupt in one of those hospitals, that it would spread at a rate that would be petrifying.
Well, the state of our hospitals has got certain challenges, and we have spoken about this, the fact that there are staff shortages, that in some instances the infrastructure is having problems. However, it doesn't mean that when there is an outbreak of this nature we are not able to respond. All that it requires is to identify areas where we've got adequate capacity to isolate the patients, to give them the necessary treatment. Our professional staff are actually good. They will be able to handle any kind of problem of the nature that is expected. But what I think is important for us is to continuously be on the vigilant to ensure that we detect any suspicious presentation, and make sure that we can check and make sure that there are no cases that are found without us being able to take care of them. At the moment, we have actually been testing more people.
Okay, one of the treatments that's been put forward as a possible solution are the antiretrovirals that are used to treat HIV/AIDS patients. If that is a success, how are we able to utilize that if and when it hits this country, considering how many people rely on those?
You know, on a problem such as the coronavirus, which is new for the whole world, so we have to actually go by clinical experience of the countries that have dealt with it. I think a lot of lessons will come from China, that has treated the largest number of patients at this point, and therefore we will use the guide that they are already utilizing. Those antiretroviral agents that they use will actually be the ones that will have to follow and utilize at some point. But the immediate issue is to deal with the subsequent manifestations of the infections, which are generic. So someone who comes in with this virus will have the fever, will have the cough, will have the respiratory symptoms, and therefore what is immediately needed is barrier nursing care as well as supportive treatment, which means that it's the manifestations that need to be managed irrespective of the causative agent, that is the virus.
Anna, but do we have the drugs here? If that is the solution, the antiretrovirals, do we have enough in this country already?
Well, look, these drugs that are being used are fairly new inventions. So at the moment, the most important thing is to actually offer the supportive treatment. People will come in needing to be ventilated, needing to be given treatment for the additional pneumonic manifestations. All of that we should be able to deal with. But to be able to get the drugs that are needed, it's something that doesn't take a long time to procure. But the main issue is that those drugs are an issue that has subsequently been brought onto the stream in China. It's not something that was the original standard way of treating the disease. So we will actually be updating all of that and make sure that whenever there is a situation arising, we are able to procure as much of the drugs that are needed.
Okay.
Right now, the major focus is on the basics, which we are ready to manage.
Tell us about the South Africans in China. What are the conversations with them?
Well, the first challenge with South Africans in China is that South Africans don't report to the embassy to indicate their presence. So no one can give us an exact number of how many South Africans. The estimation is that we've got probably about 3,000 of them. A number of them are in Wuhan and Hebei province, which is about 200 people, mostly students. And we have been in touch. DIRCO actually calls as many of them personally, individually, to find out their own status. None of them have been reported to be sick or infected with coronavirus, and are very fortunate on that. Secondly, all of them are responding to the guidelines that are being given to prevent infections, and so they are very respectful of the guidelines that have been given. And in some instances, they reported challenges with shortage of food. When they do, we actually talk to the Chinese government so that they provide for them. And there have been instances where they've run out of medication which is not available in China, and we have sent that medication to support them. We are actually monitoring the situation on a daily basis.
Okay, but I mean, what are we waiting for? What if somebody gets infected there? Why not evacuate all of the South Africans that are in the province?
Well, to be honest, as we speak today, China has done quite a lot to be able to manage the infection. It is not as though evacuation is without the risks. There are some countries already that have got third generation spread of the disease from where they've got infection that has come from people who are already outside of China. So there are risks associated with it.
Okay,
However,
sorry, I mean, what are the risks? And China hasn't managed to deal with this viral outbreak.
Well, sometimes I think people take this thing very lightly. The reality is that the spread of such an outbreak requires limitation of movement of people. Sometimes when we look at it, we need to understand that, keeping people to be where they are, away from those who are infected, is the safest way of dealing with the disease. In this case, South Africans who are in China, none of them have reported that they are in any specific risk. There are more panic from people who are outside in South Africa, which is understandable, and we have to keep reassuring them. But should there be a situation arising that there's a need to evacuate, of course such a decision can be taken, but I think we need to understand that when people come to South Africa, it's actually even more challenging to manage the situation where it's very difficult to restrict the movement of individuals inside the country. People will have their rights. They can only be where they are. You can only quarantine them because they've agreed. If they don't want to be quarantined, you have now got to take extra steps to prohibit their movements and all of that. So all of those issues are serious challenges that we must keep in mind as we move on. Okay. But we will be able to respond. If there's a need for that, we'll actually be able to deal with it.
Okay, Minister. Thank you. Now, Lesotho's